Critical care transport is the highest level of care that we offer at Royal Ambulance. A critical care transport unit is staffed by 2 critical care EMTs as well as a critical care registered nurse. And that team is responsible for transporting our highest acuity patients.
Critical care transports are going to be patients that are basically ICU patients. They're either going to an ICU, they're going to an emergency surgery, they're going to a higher level of care, but they're patients that generally are going to be less stable. Any patient that requires interventions that BLS can't do, and that pretty much is going to be anybody on IV fluids, anybody that's on a vent, anybody that's on telemetry, anyone that has a chance where they're going to need an ACLS intervention. And the scope of a CCT transport RN is greater than that of a paramedic, but we can still do the interventions a paramedic can do. So we can intubate, we can do IOs, we can do needle decompressions, and we have a standard order set that we use underneath our medical director where we can start IVs, we can start IV fluids, we can start vasopressors, we can give ACLS meds, for instance. So the nice thing about the CCT is that you have a lot of time with your RN. So we'll always have one EMT in the back with the RN when we're transporting a patient, but then even when you're not on calls, you'll have a lot of time out in the field where you can talk with your RN and gain some insight into things. And it really is a nice opportunity for the RNs to teach, especially people going on further, because we're going to do interventions and we're going to be able to talk about that, take a look at this rhythm that we see. Hey, this is AFib, this is a heart block, this is how we would treat this. So you're going to get the opportunity to see things, and become acclimated to the medical environment. And it'll just make, once you start your, whether it's RN, MD, PA, or, a lot of the other types of schooling that you have, it'll give you a leg up because you'll already have some understanding when they start talking about some of these things.
Being able to be partners with our registered nurses, watching them treat the sickest of sick patients, managing stressful situations, and just providing amazing bedside care and empathy towards our patients has allowed me to really develop myself as a healthcare professional and understand what it takes to be really experienced in the field and what it takes to grow in the field. And I think at Royal we really foster an environment of growth, mentorship, and community that I think really echoes through our nurses, and it's something that every time I clock in for shift on a CCT unit, I know that I'm also here to work, and I'm here to have an amazing experience, and I'm also here to learn. And I think those 3 things is what really makes Royal Critical Care Transport special.